now we're facing the Delta variant versus last year's COVID strand, and of course there's new ones that keep popping up all the time. What can you tell us a little bit about the difference between caring for patients last year versus this Delta variant?
I feel like they are sicker. They're younger, healthy, very athletic, and then when they come in and they're very sick and they're declining fast. So that was not the issue last year. I feel like.
Yeah, and there's more patients and they're sicker and they're staying much, much longer.
Absolutely.
So like your average length of stay for a normal patient would be what versus a COVID patient?
Oh, like a patient that would come in with pneumonia, like just a pneumonia patient historically, might be in the hospital, maybe 2 or 3 days. And these patients that come in with COVID pneumonia, I mean, what's some of the longest?
5 to 6 weeks in the critical care unit.
So I have some on the floor that have been 3 and 4 weeks now.
And then you also have to remember too, that's 5 or 6 weeks without seeing their family or their family seeing them. And that's terrible for these patients and their families.
I think last time we were seeing more cold-like symptoms like runny noses, sneezing, coughing. This time people are coming in severely short of breath. They may or may not be coughing. They may or may not have any sinus drainage at all. They just can't breathe. And that's the big thing that we're seeing right now.
And their oxygen level is low.
Right, very low.
Yeah.
You want your oxygen levels above 90. I mean, typical nursing, when they start to drop below 90, we know we have something to do. We have an intervention. Even if they drop below 94 sometimes, we know we need to look at an intervention. But these patients, their oxygen levels are in the 70s, 80s. Some of them are in the 60s. Some of them are not
40s.
registering.
Yeah.
Some of them are lower than that.
Like before they would come in and their oxygen might be in the 80s, they wouldn't feel short of breath.
Correct.
I mean, they could carry on a long conversation with you. This time, if they're 90, they're struggling to breathe. So I'm not sure what the difference is in the virus, but it's a big difference when they're, their levels of oxygen this time.